Empty sella syndrome, abbreviated S, is where the pituitary gland shrinks or becomes flattened, filling the sella turcica with cerebrospinal fluid on imaging instead of the normal pituitary. S can be found in the diagnostic workup of pituitary disorders, or as an incidental finding when imaging the brain. Classification. There are two types of S, primary and secondary. Primary S happens when a small anatomical defect above the pituitary gland increases pressure in the sella turcica and causes the gland to flatten out along the interior walls of the sella turcica cavity. Primary S is associated with obesity and increase in intracranial pressure in women. Secondary S is the result of the pituitary gland regressing within the cavity after an injury, surgery, or radiation therapy. Individuals with secondary S due to destruction of the pituitary gland have symptoms that reflect the loss of pituitary functions, such as intolerance to stress and infection. Signs/symptoms. If there are symptoms, people with empty sella syndrome can have headaches, as symptoms, which subsides when lying down. Additional symptoms are as follows. Abnormality, middle ear ossicles. Cryptorchidism. Dolichocephaly. Arnold-Chiari type I malformation. Meningocele. Patent ductus arteriosus. Muscular hypotonia. Platybasia. Cause. The cause of this condition is divided into primary and secondary, as follows. The cause of this condition in terms of secondary empty sella syndrome happens when a tumor or surgery damages the gland. This is an acquired manner of the condition. 70% of patients with idiopathic intracranial hypertension will have empty sella on MRI. The cause of primary empty sella syndrome is a congenital defect, diaphragma sellae. Mechanism. The normal mechanism of the pituitary gland sees that it controls the hormonal system, which therefore have an effect on growth, sexual development, and adrenocortical function. The gland is divided into anterior and posterior. Its pathophysiology is such that individuals affected with the condition can have cerebrospinal fluid buildup, which in turn causes intracranial pressure leading to headaches for the individual. Diagnosis. The diagnosis of S, done via examination and test, may be linked to early onset of puberty, growth hormone deficiency or pituitary gland dysfunction, at an early age. Additionally, there is CT scan, MRI scans. Differential diagnosis. The major differential to consider in empty sella syndrome is intracranial hypertension, of both unknown and secondary causes, and an epidermoid cyst, which can mimic cerebrospinal fluid due to its low density on CT scans, although MRI can usually distinguish the latter diagnosis. Treatment. In terms of management, unless the syndrome results in other medical problems, treatment for endocrine dysfunction associated with pituitary malfunction is symptomatic and thus supportive. However, in some cases, surgery may be needed.
Please subscribe and thanks for watching.